Okay, hi everyone. We're just getting started streaming to Facebook. Okay. Okay, people are coming in. So welcome to our first brown bag of 2025, the history of diabetes policy and our rights. Wait, you don't see the pop-ups on my screen, do you?
Yes.
You did? Oh my God. Okay, well, whatever. Um, if you're new to DPAC, which I think we actually do have a lot of people who are new to DPAC on this call, we ensure quality of and access to care, medications, and devices for people living with diabetes. And we try to educate, inspire, and empower patient advocates as well as lawmakers toward meaningful action. So we train people in the diabetes community on how to best tell their stories when they speak with lawmakers and elected officials. And on the flip side, we also speak with lawmakers and elected officials on the lives of people living with diabetes and the experiences that everyone goes through. So for our two speakers today, we have Tom Boyer. He is the Senior Director of Public Affairs and Advocacy for DLC and DPAC. Tom has over 20 years of experience rooted in driving and securing improvements in diabetes care and insurance coverage via government affairs or lobbying, public affairs, public relations, and patient advocacy. Jake Johnston is president of the Johnston Group, a federal lobbying firm based in Seattle and operating in Washington, D.C. Jake has worked as a federal lobbyist and public affairs consultant for 20 years after working in Congress for nearly a decade. Jake is also the co-founder of Connect T1D, now T1 United, a nonprofit organization providing social support to people impacted by type 1 diabetes. So we have two really renowned speakers in our midst today. um, so Tom is DPAC staff at DPAC, and Jake is a volunteer on the DPAC board. So we're really excited to have you guys here today. Thank you for joining us.
Happy to be here.
And you guys are in two very different attires today. I can't help but notice we've dressed all for different occasions here.
I feel
Um,
like I feel like Tom's representing the staff component here, with the professional outlook, and I'm clearly the volunteer person. Also, I live in the great state of Washington, and flannel is a legal requirement in our community.
And Amanda, but you are missing out on the eyeglass side. So we'll forgive.
Oh, that's true. I could go pick up mine and then we can all be matching. Okay, so let's get started with our first question. So, can you walk us through what you think are some of the biggest milestones, wins, and important events, both in the history of diabetes policy?
You want me to go first, Jake? You want to tackle that one?
Now, you start, Tom, please.
Okay. To provide a little background for folks, Jake and I have been really engaged as advocates since our teenage years, since around age 16, 17, 18. We were part of a program that trained a number of advocates on really how to advocate, how to meet with members of Congress, and how to push for legislative and regulatory change to benefit people with diabetes, and really people with chronic disease. If I were to, make it much broader than that. So our goal is always to spread the gospel, to get more people involved and engaged, and that's the reason that we're here speaking with you today. Our goal is to share knowledge, not to share information, but really to enlist more people in the cause. That's why we became engaged at age 17, 18, and really have kind of had this interesting perch by which to advocate and watch these legislative and regulatory changes help people, and occasionally see some things that don't work out so well for people with diabetes. But really the emphasis is on adding to and improving the rights that folks have. I would say that fundamentally everything began to change for the better for folks with diabetes in the around 1990 with the Americans with Disabilities Act that then President George Bush, the first president, signed into law. He had this big initiative called 1,000 Points of Light, where he was encouraging that government reward and recognize the contributions of people from all walks of life that were a point of light. And this became a signature legislative issue that he and then Senator Ted Kennedy worked on. Jake and I, this was one of the first issues that we ever worked on and advocated for as 17-year-olds, and pushed for it. And lo and behold, the darn thing became law, which established this framework of civil rights protections for people with diabetes that did not exist. Without that provision becoming law and the courts supporting it, I'm just not sure that we'd be able to talk about all the other improvements that have been constructed and enacted for people with diabetes. Jake, what do you think?
Tom, you nailed it. The Americans with Disabilities Act was the foundational protection that kind of all of the rest of the work that's happened for people with chronic illness and for type 1 diabetes has really relied on to be that foundation that we deserve protection under the law, and that we deserve access to healthcare and to treatment options at an affordable cost. So kind of riffing off what Tom said, I think that the next major milestone, of course, is the Affordable Care Act. And for the first time, the ability for people to not be discriminated against based on having a pre-existing condition, their ability to enter into the insurance marketplace and purchase insurance, so you weren't necessarily tied to a large employer anymore. I actually started my business and was only able to do so because the Affordable Care Act made it possible for somebody with chronic illness to obtain health insurance and to do that for myself and my family. I have type 1 diabetes. I've had type 1 diabetes for 50 years, which is a little surprising to me. But I'm also the parent of a type 1 child with type 1 child with diabetes. Of course, that's a little redundant. She's actually in college right now. So try to see some of these policy issues, both from a person with type 1 diabetes and then also from a parent standpoint, from looking at kind of what my daughter's going through right now in the workplace. But I think, yeah, in terms of what were the foundational laws that really created the foundation for everything else that we're fighting for right now, it is absolutely the Americans with Disabilities Act and the Affordable Care Act. Those two things.
Thank you. Yeah,
And
following up on, sorry, Tom, go ahead.
Just one thing made the Affordable Care Act very important for people with diabetes, and I don't want to diminish the focus on the state side, because right now we're talking about federal protections. But one very important piece that made this thing called an essential health benefit in Obamacare, the Affordable Care Act, was the fact that 46 states had enacted diabetes health insurance mandates. The fact that many states had acted, and in fact, it was the high watermark for all of the benefit mandates that were incorporated into the Affordable Care Act. And the federal government took the point of view of, well, since 46 states, a majority of states, have enacted these provisions, we will establish this baseline of care for people with diabetes in the Affordable Care Act. So you never know what's going to come first. Is it the chicken or the egg? But all of these things have to work together, and people with diabetes need to bring their voice forward and share that voice in order for all of the things that we're discussing today to have an impact, and a positive impact on folks who need their rights protected, including me, including Jake, including Amanda, including everyone that we advocate for.
Thank you. Yeah, just to follow up on the Americans with Disabilities Act, I wanted to ask specifically what protections were in place prior versus after, from the perspective of the diabetes community. Like, what was the lived experience like before the Americans with Disabilities Act and after?
Oh, that's a good question. I can speak to this a little bit. I think from the civil rights activity, when I say civil rights activity, I mean the legal activity to protect the employment status of people with diabetes in situations where they could have been discriminated against or had their rights taken away from them. So prior to 1990, it was fair game to discriminate against a person with any unseen medical condition. The fact that the Americans with Disabilities Act created these protections for these diseases and conditions that are unseen, that aren't necessarily in the forefront, really gave folks protection, like the ability to take a break to deal with a low blood sugar event or a high blood sugar event, the ability to structure your day so that you can actually have a pad that you can stand on if you're standing on concrete for an extended period of time because you have neuropathy. Those things did not exist. Those protections did not exist prior to 1990. So it was a complete negotiation with your employer. Now these things are there and we can rely on them. Over the years, 20, 30 years at this point, I've been involved as an advisor on a whole bunch of civil rights activity, everything from restoring the rights of commercial pilots to be able to fly, to some really incredible folks who are serving in the United States military who would have had their jobs taken away from them, FBI agents. We've been successful in restoring rights for people who fly planes, who work in the military. Less so for law enforcement, and there's a lot of conflicting law on that. But that's where we are. We've done a lot of good work. Commercial drivers too.
Let me add a little bit more to that too. So the Americans with Disabilities Act, not just from an employment discrimination standpoint, but it created a legal opportunity for us to go pick fights in other ways as well. So for example, as states, after the Americans with Disabilities Act went into effect, states started looking at what do we do in the classroom for kids with diabetes, right? And this is where states started to make we picked the fight in the state to protect a student's right to administer medicine in the classroom. So prior to the Americans with Disabilities Act, kids would be forced to go to the nurse's office, for example, to do any type of injection or blood testing or things like that. And in some cases, like out here in the state of Washington, we had school districts who would move all kids with chronic illness into a common school where they could be appropriately medically resourced. So kids didn't have the same level of protection kind of in that environment that they had after the the Americans with Disabilities Act. Essentially, we created a protection for people that said you can't treat people with diabetes differently from a rights and access standpoint. And that just continues to play out in everything from access to medicine, cost of medication, rights that you have in the classroom, rights that you have in the workplace.
Thank you. Yeah, that I can't imagine what it was like to live with diabetes prior to that. And on that note, much of our rights were gained so recently in American history. I wanted to ask, why do you think that is, and what does that mean for us as advocates?
I'll go first, Tom.
Okay, yeah, I have some thoughts too.
I don't know the exact question to the why so recent. I think that's I'm not sure there's a single answer to that question. But I think that what I do know is that the Americans with Disabilities Act was 1990. So, 30 some odd years ago, right? And the Affordable Care Act was, Tom, probably off the top of your head, what, 12, 14 years ago at this point. And all of these rights create a better foundation for the next fights to follow. We would not be fighting about insulin pricing right now if we didn't have a foundation that had already established that people with chronic illness have a right to access healthcare at an affordable cost. We would not be fighting about like how to make sure that new technologies get to market to serve people with diabetes without kind of this previous framework. So the more work we do to build a stronger base, the more actions we can take. And the threats today are maybe less about rights and more about access and cost. And picking those access and cost fights wouldn't be possible if we hadn't already pre-laid this foundation that determined that people with chronic illness have a right to be healthy.
Yeah. I also, if we ask why 1990 post, what had happened? Well, Medicare had been established in the 1960s to really, go take us back in time. And then we were kind of in this stagnant period where the bulk of the focus was on the environment. In the 70s, there were some energy crises that happened. Boy, am I dating myself right now. And I'm trying to go through. We had some real consequential foreign policy things that were occurring in the United States as well in the 70s. And I think that the disability issue, the chronic disease issue, we were starting to see more and more chronic disease affecting people. Americans were living longer, and we were seeing these acute needs that were happening to ultimately say, hey, a person who is different from a disability health point of view is no different from a civil rights point of view in the eyes of the United States. I think that there was some magic that happened between Ted Kennedy and George Bush in being in the right place at the right time and having an ability to talk to each other. And if I were to really encourage Congress today, it would be to find this way to talk to each other, because that's what kind of made it all happen. But the fact that we're only going back to 1990 means that some of these protections are somewhat tenuous, which ultimately means that folks need to get comfortable expressing their opinion in a way that leads to the desired outcome.
Yeah, Jake, do you have anything to add to that?
I think, I don't want to oversimplify kind of the fight, but the fight really, I think in right now in 2025 comes down to access versus cost. And I think that that's maybe an overly simplistic way to look at things. But right now, Republicans have unified control of the federal government, and as such are really embarking on a cost-cutting effort. We'll see how successful they are. But in doing so, right, the ability to get access to medication is at risk for people with chronic illness and type 1 diabetes. So this foundation of rights that we've established is also what we have to bring to this fight, right? Treating people with our condition does cost money. And if you take money out of it, there's a cost in terms of people's ability to have the choice of the products that they want to use, the choice of the technology they want to use, and the ability to pay for it at a reasonable way. So I think that past is prologue, of course, but never taking a step backwards on the rights that have been earned, because they're the foundation of how we pick the fights of today and tomorrow.
Yeah, that's knowing the history is super important in terms of being an advocate, and that's something that I'm also learning every day that I advocate. Can you tell us a little bit about your specific professional or personal experience on top of this context? And what was it like to witness these kinds of changes firsthand, having had that experience or participate in them?
You go first, Tom.
Oh boy. Um,
Dating yourself once again.
I am really going to date myself right now. Um, so I'm I'm a bit of an anomaly in this entire universe, because I happen to be in the proverbial room where it happens during a lot of these efforts and a lot of these fights. My experience started on Capitol Hill as a member of President Clinton's healthcare task force. It started prior to that, but that was my first consequential effort in the healthcare space. And I was a staffer to a member of Congress from Arkansas. Her name's Blanche Lambert. Blanche Lincoln is her name today. Phenomenal human being, phenomenal legislator. Think the absolute world of her. But being in the room, negotiating the finer points of healthcare policy for the country for the better part of 2 years of my life, and then watching it fail, had a profound influence on how to frame a legislative matter to achieve success. And it ultimately helped me immensely in helping to establish some policy ideas and enact some of those policy ideas. I'm very fortunate in that a number of the policy ideas that I came up with a number of volunteers are law today. Everything from test strips for people with type 1 and type 2 diabetes, coverage for that in the Medicaid program, coverage for insulin pumps in the Medicare program, a number of provisions in the Affordable Care Act, a number of provisions that were written into statute in Medicare Part D, which is the drug benefit for people over age 65 and those who are disabled. All these protections that are in the exchanges, and it just goes on and on and on. What was it like to be in the room where that stuff happened, I can't think of a better career to have. I mean, this is what I dreamed of doing from the moment I sat on a hospital bed, diagnosed with type 1 diabetes at age 14. I mean, when certain doors were closed to me, I always wanted to fly jets. I wanted to be a Blue Angel. That's what I wanted to be. And when that door closed, where the doctor was explaining it to me, how I just don't have certain rights that will be afforded to me, I said, well, that stinks. I can't do that. Well, let me try to figure out the rights that I do have. And it just kind of set me off on this crazy path. I certainly didn't think that I would still be doing this at the age I am now, when I was this 16, 17-year-old at a Youth Leadership Congress with Jake. But Jake and I our careers have just paralleled each other. We were both on the Hill at the same time. We've both worked as lobbyists. We've both worked in communications and public affairs. And we've just been, I would argue, great resources for each other in coming up with just some incredible ideas that help people with diabetes along the way. Mutual Admiration Society. So, well, how is it to be in those rooms? Pretty cool. I've got some stories. But I've been admonished that if I mention some of these stories, that I will have to donate certain money to various causes, and I will refrain from some of them.
The Mutual Admiration Society is clear, and this is not just a Tom and Jake love fest, but please know, one note on Tom, there is no greater person in America who knows more about diabetes policy and has had a greater impact than Tom Boyer. Tom has been in the room,
thank you,
fighting for people in this area for decades. And I feel really lucky to have Tom in my life. And I think as a community, we're really lucky to have Tom's leadership. My focus point is less on the policy side. I have not been a lobbyist in the room where it happens. Mine has been on building an advocacy network and building people and plugging them into the fight in ways that make sense. So my answer to Amanda's question isn't so much about what did it feel like to be in the room where it happened, to misquote Hamilton, but at a different place, it's like the feeling you get from helping people connect the dots between their own stories and what they're experiencing, and then the opportunity to tell that story in a position of power, in a position of influence, in a way and at a time to make a difference. And so we've had a couple of examples, out here in Washington State, where we were able to mobilize a relatively small number of people in a relatively quick amount of time and tell a story to the governor or to a state legislator or at the federal level to a member of Congress, and really show them the human impact of what the impact of their vote would be, why that was important. And so you need two things in a really successful advocacy campaign, right? You need to have whip smart policy people who understand this stuff inside and out. And I think Tom exemplifies that, and then you also have to have an army of voices that care about the issue and speak with passion and can take the issues and not be an expert on the subject matter necessarily, but be an absolute world expert on the impact that those things have. We don't need everybody in the insulin pricing fight to know everything about how prices get negotiated in Medicare. We need everybody in that fight to say why affordable insulin is important to them and the people they care about. And that's the difference. So I think Tom and I are two sides of a coin, and both sides are really, really important.
Oh, you can't, if you don't have both sides of the coin, this does not work. Jake knows a little bit of this story, but I used to take people into presidential candidate town hall meetings. I can't ask a future president of the United States a question. I am a lobbyist. I am a person who has seen them I have followed them from New Hampshire to South Carolina to Washington to Michigan. I need the person in those states that is willing to tell their story. I can help put you in front of somebody. I can guarantee this, if you've never done this type of thing before, it will be one of the most intimidating things that you've ever gone through in your life. The opportunity to ask a future president of the United States a question is incredibly empowering, and it's a right enshrined in the United States Constitution. the right to free speech. And I have had people that come back to me and say, I am so thankful that I had that opportunity to get in front of President, back then, candidate Governor Bush, the second, George W. Bush. And I'm so thankful to have that opportunity. And I reflect back so fondly on that. And thank you for giving me a call and asking me to do it. But I can help you frame your question. I can help you frame your story. You just have to be willing to tell your story. We need all sides of this. Otherwise, we lose the rights that we've been afforded.
Oh, thank you. This is the best way that I've ever heard this explained, and it just underscores how important both the advocates and, you know, the policy experts are when they work together. And I want to emphasize that as a DPAC advocate, I know you've been saying this, but you do not have to be a policy expert. You really just have to show up, use your voice, and be the person who has diabetes to talk about what it's like to have diabetes and feel the consequences of these pieces of legislation. So not to interrupt the love fest, but what about pushbacks? And what is an example or examples of times when the diabetes community hit a wall or found a way around it?
Oh,
I got one.
you go, Jake.
Um, Again, out here in Washington State, we this would have been, don't quote me exactly on the time frame here, but roughly maybe 12, 13 years ago, the state of Washington was really concerned about the growing cost of the Medicaid program in the state. The primary healthcare program insured low-income people and people with disabilities. And in doing so, they convened a panel of experts to look at where were expenditures in the Medicaid program going, and were there ways to constrain those costs? And that generally meant, can we put people on less expensive medication, you know, assuming that there's an equivalency between them. Anyway, out of these 5 people, nobody had an endocrine background, and there were no patient voices on the panel. So one of the recommendations that came out of the panel and that they tried to implement was limiting the number of test strips that Medicaid in the state of Washington would cover to 1 per day. And this is pre-CGMs for those of you who, I have no idea how old people are on this call. But you know, can you imagine trying to manage your daily diabetes, only being able to do 1 blood test a day? That's I mean, it's asinine, right? But we didn't have any stories, and we didn't have any expertise, and we didn't have any policy experts that were involved in that decision making. So kind of as soon as this came out, we were extremely concerned. And there were 2 doctors in the state of Washington that saw a lot of Medicaid patients. And then we, as volunteers, just started flooding the zone with kind of information. We got people to put comments in on the policy change. We got people to testify. We got people to call the governor, you know, and kind of just raise the temperature on the issue quite a bit. And we were able to actually prevent that from happening. So I think that's a direct answer to your question, Amanda. Like this was kind of, I don't know, it was an error based, or it was a policy based exclusively on cost and not in any way, shape, or form about medical efficacy. And we killed it.
Yeah, yeah, and you know, it's interesting. Some of my memories are actually going to come to Washington State too. It ends up, it's an interesting state in how it kind of wants to test the limits. It wants to expand these protections, but then also test, well, what happens if we constrain some? And the Safe at Schools Act in Washington State, I remember an effort to repeal that about a decade ago. Out of nowhere, we just see this effort, and I ended up going in to meet with the sponsor of the effort to repeal it and said, can you help me understand why you want to repeal it? And they said, well, sometimes we just want to make sure that people still care about these issues. And I looked right at the legislator and said, rest assured, we still care. Please, please don't rescind these rights. Please don't rescind these protections. And there have also been efforts in state Medicaid programs to eliminate coverage for insulin pens, which is an incredibly detrimental policy position to take when you want kids to manage diabetes during school hours, and you're trying to contain the flow of what one could think would be an illicit drug because a syringe is being used. Well, you use a needle with a pen. So we see these interesting efforts that come along. I would also suggest that the effort to repeal the ACA, the Affordable Care Act, Obamacare, in Congress was something that I hope had everyone's attention about 8 years ago, because it certainly had mine. That would have been a consequential rollback in rights for people with diabetes, especially in states that have not constructed their own exchange. That would mean states like Washington, Oregon, California, New York, New Jersey, Michigan. They probably would have been more likely to be okay, but without the federal support, the program goes sideways. And I can argue until I'm blue in the face how consequential a civil rights protection the Affordable Care Act is for people with any form of diabetes, and arguably obesity too.
Yeah, I just want to take a moment to acknowledge, I see the questions in the Q&A. We will get to those in 1 second. On that note, historically, I know we've given some examples, but are there certain difficulties that the diabetes community has faced time and time again, or consistent barriers to progress that we can work on as a community?
Do you want that, Jake, or?
I think
Gross ignorance. Is that an appropriate answer? I don't know. I mean, for me as an advocate, it just, I get tired sometimes telling elected officials the same story, right? That like, hey, when you prevent me from getting access to my medication, like it's going to have consequences, both for me as an individual and my family, but also long term in terms of cost to the system. And I feel like I have to tell this story just all the time. So I get extremely frustrated that there does not seem to be a recognition of like long-term issues for people with chronic illness, as opposed to how do we cut costs, or how do we constrain this beast, you know, in kind of individual dynamics. I'm not sure if I answered your question correctly or not. I just clearly went off on a rant there. Dumb elected officials. That's what I don't like.
I can amplify that. I'm heartened by the fact that I've rarely met an elected official that does not want to hear the story, though.
Yeah.
And that they are often movable from their base position to one of accommodating the needs of people with diabetes. I've heard this over and over again throughout my career, and it doesn't matter the political ideology, the political stripes that we're talking about from somebody that they may or may not have. But I've always run across an openness. The greatest frustration that I have, and I constantly use this analogy, so I apologize if folks have heard it before, but we are a community that, if I were to put it in terms of a football team, and when I say football, I mean soccer, international football, we barely have enough folks for a starting 11, meaning that we can field a team that starts. We need to have people that constantly show up, that want to be engaged. And I really think that Jake is hitting a key point here. We need more advocates and people who are willing to take their shot at convincing somebody that protecting people with diabetes is the right thing to do. And I've seen it consistently throughout my career. There are a lot of folks that were involved in that program that Jake and I were trained in. We're two of a very limited number of folks that are still engaged in advocacy today.
Yeah, let me turn over to the chat box now. Someone said we had the 1 strip per day problem with my mother in 2024. Oh, 2024. Wow. I'm so sorry that I had never even heard of that actually until Jake told me for the first time. That's really just a ridiculous thing that anyone should have to go through. Oh, someone asked, with whom should we talk about our story? Where to begin? Perfect question.
Yeah,
If-
I'll jump into
yeah.
that one. There are multiple groups out there that are doing work in the diabetes advocacy and policy space, the American Diabetes Association's got a long track record of fighting in this area. Every group has a different point of emphasis and maybe different strengths and weaknesses. But ADA is one, Breakthrough T1D, formerly known as JDRF, kind of operates at the federal level. Type 1 United kind of operates on a global basis and somewhat in the United States on different fights. And then, of course, DPAC. DPAC is kind of the organization that we are all part of, myself as a volunteer and Tom and Amanda as staff. And DPAC gets involved at both the federal and the state level, which I think distinguishes it from most of the other groups, to really look at where they can move the needle on these fights and continue to build that platform in those spaces. So some of these groups have advocate training programs. DPAC's is exemplary. DPAC has a way that teaches you kind of how to tell your story, how to plug into the advocacy movement, and then for people who want to get more and more involved, actual formalized training in terms of how to become part of the Champion Corps, how to go to DC, how to go to state capitals, how to be engaged in these fights. So basically hit up Amanda kind of on this stuff. And if you're interested in like developing your story and like kicking the tires and getting a little bit more involved, there is literally there's so much room for you at the table. We'd love to have your story.
Thank you. You sound like almost like
So
a DPAC staff member.
if I may, I just need to provide an aside. There's someone who's in the chat. She asked a question, Kim Colbert. I was working on a provision last year for type 1 diabetes screening, trying to get education materials into schools. Like folks are asking this question, how do I get involved? How do I get engaged? Well, first, if you get a chance to talk to Kim. Second, here I am working on this bill, and Kim got a hold of it and actually ran it in Oklahoma and made sure that it became law before any state that I was working in a very coordinated way. True story, absolute true story. Well done,
Kim is a
Kim.
DPAC champion.
She's a
He doesn't work with us.
Yeah, DPAC champion,
Yeah.
and she's not paying me to say any of this. I see the question here, but truly, it's if you see something that you like, reach out to us, and we will try to figure out a way to help you do it. Or if you're really good at what you do, just go ahead and do it, as Kim did. And it's not the first time in my career that Kim's done that. She's just very good at what she does, and I want to use that as an example to amplify the stories that we're seeing here.
Yeah.
Someone asked a question about, is there a list of legislators who support diabetes advocacy? Do a search on Google for the Diabetes Caucus in the United States House and the United States Senate. Those legislators that are members of the Diabetes Caucus are a pretty good place to start to get an understanding of who cares about these issues. And if you see on that list that your legislator is not engaged, ask them to get involved. That Diabetes Caucus is something that Jake and I actually worked on a real long time ago, and it is still around today.
I'm sorry, Tom. I got to disagree with you. This is where
That's fine.
Where the love fest falls apart.
It only goes so far, but
any member of there are 1,000 caucuses in Congress, and any member of Congress is allowed to join a caucus, providing that they kind of demonstrate an awareness of the issue and an interest in being involved. But the caucus itself is generally a communications tool, not so much a legislative tool. And what I mean by that is the Diabetes Caucus might put together a letter and invite the caucus members to send a letter to the Speaker of the House or something to prioritize a certain issue. But the problem is that right now in the Diabetes Caucus in Congress, that there's no accountability for people who don't vote for people with diabetes. So there's no way to kick somebody out of the caucus, and there's no requirement that a caucus member votes in support of diabetes policy consistently. So for example, right now we have a majority in Congress that are members of the Diabetes Caucus, but we still are fighting efforts to repeal rights and costs and access issues. So just signaling that you're a member of a caucus is not enough. It's actually looking at votes. And it's hard to do because Congress isn't taking a lot of votes on individual policies anymore. When we get things done, they tend to be pieces of other bills, or they tend to be small parts of larger initiatives. So it's really hard. It's a very easy question, who's with us and who's against us, but we don't really have kind of a formalized scorecard in that way. The caucus is a good place to start, but it's not the answer to your question. Sorry, Tom.
That's okay. That's fair. Some people use it as a way to block progress because they say, has the Diabetes Caucus considered it? Until the Diabetes Caucus takes a position, I won't take a position. Each of these tools that we're recommending only goes so far as being a useful tool. We sometimes need to pull additional golf clubs out of our bag to get the ball on the green. To use another sporting analogy, a sport that I don't play any longer. So someone asked one question about what 4 states don't have a provision for diabetes care in the Affordable Care Act. The good news is that the Affordable Care Act means that all 50 states have the benefit. So keep that in mind. I don't want to cast any dispersions on our friends in Alabama, Maine, and a couple of other states, but those were states that were not quick to pass the Affordable Care Act, but now they have to follow the provisions contained in the statute.
Yeah, we're running a little bit short on time, so I'm just going to go to our last question, which is how would you describe our current landscape of diabetes policy and where should we focus our efforts as advocates?
um,
But you go first, Tom. I think I've got an answer.
So no, you go. I'll close. I
think right now, and again, I want to make clear that this is just my opinion. I don't get paid to work in diabetes. I've never done that. It's never been a factor for me. But what I see is that we are so freaking close on getting affordable insulin for everybody. And all of the momentum was there. You had presidential candidates talking about it on the campaign trail. You had you had Schumer in the Senate committing to bring up this for a vote before the end of the year. That didn't happen, unfortunately. But it kind of feels like we're on this precipice of action where diabetes policy is really becoming part of the political landscape and part of the policy landscape. So that's the good news. But at the same time, I think we are at extraordinary risk because of the priorities of a Republican Congress and the Trump administration. I think that Speaker Johnston in the House has already said that they're going to take a look at the Affordable Care Act and look at reforms there. We're already looking at massive cuts in entitlement spending, which is Medicare and Medicaid, and kind of what is the downstream effect of that on people with chronic illness. And I think that we don't necessarily have a track record of priority within the Republican Congress for looking out for new rights and new protections for people who need them. So I think that we are both building power at the same time that we are at increased risk. And I think it's going to be a really exciting year to look at it from a distance, and it's going to be hair losing, for those of us who are kind of in the fight. And I invite all of you to do a little bit more than you're doing right now. If you're staying informed on these issues, that's great. Take that and then turn it into how you tell your story about the issues. If you've never talked to an elected official about, hey, I care about diabetes policy and I want you to keep me informed, so they know that you're watching them on these policies, do that for the first time. Start to follow these groups. DPAC's got a really active email list. Make sure you're signed up on that and look for ways to add your voice to the fight. The more voices in the fight makes people like Tom, who's in the room, deliver better.
So I'm going to be agnostic about political parties that have perceived power and those that don't at any given time throughout any historical reference point. The Americans with Disabilities Act became law with President Bush's signature. Medicare Part D, or actually the initial Medicare changes, were a compromise between Bill Clinton and Newt Gingrich. Medicare Part D became law with a Republican Congress and President George W. Bush signing it into law. Obamacare became law with Democratic control of Congress, Democrat in the White House, and it's been expanded successfully at the hands of a number of Republican governors. So all of these things that have happened regardless of political ideology to a point. What I get concerned about, and this is my concern right now, is that healthcare policy isn't necessarily at the forefront of the mind of Congress or the administration. And I include both sides of the aisle in this. That concerns me because there's all this focus on cost, and not this focus on care, not this focus on what do people with diabetes need, what do people with cancer need, what do people with obesity need. It's truly this cost. And the fundamental design of the United States healthcare system is sideways. It just is. Sure, cost has to be a component, but we've done some things with our healthcare system that just are not followed by any other economy of scale across the globe. So this lack of attention is going to lead to a lack of skilled professionals being in the space, which leads me to, it is incredibly important to have advocates that are willing to speak up, because in times where I've not seen the best professionals in place, you have great opportunity to affect change simply by being in the right place at the right time.
That was a really good closer. I am going to give this one last, share my screen one last time, because this is our current action item. If you're interested in getting involved, we are urging CMS, Centers for Medicaid and Medicare Services, to provide coverage for anti-obesity medicines. So if you scan that QR code, it'll take you to the website where we have more information and where you can send your comments to CMS. And on that note, thank you to our two speakers for joining us today. It's been really great having you. I've actually gotten a lot of texts during this presentation talking about how you guys should do more. So maybe we'll have you on more presentations, and I'm saying that on live recording so that you have to do it.
Anytime. Happy to help. Glad to be here.
Thank you everyone for joining us today. And again, that bigger QR code to go to our website where you can send your comments, and the smaller QR code is to sign up to be a DPAC champion. Thank you, everyone.
One last thing, for those of you who showed up today, thank you so much. Appreciate your interest in advocacy and policy. And I got to tell you, there's maybe I should have said this earlier when Amanda asked the question about like, how did it feel? When you get to work with people who share kind of a commitment to a cause or to an idea or to a passion with you, and you get to actually watch it manifest into change, it's such a powerful, positive, affirming feeling. And I feel like we're walking into a world that has a lot of threats in it right now, you know, from a policy standpoint. And I love the idea of people building their voices to combat that. So I look forward to working with all of you, and I hope you find ways to join the fight. It's fun and it's affirming and it makes a difference, and we do great work together.
Thank you. Yes, and one person in the comments said they can't use the QR code, so we have actually sent out a email blast, and it'll be on our social media as well. But thank you, Jake, and thank you, Tom, for joining us today, and have a good day, everyone. Bye.